every disease, or there is only some disease, special disease?
No, should I say one thing to you? Even the doctors are my patient of big hospitals. Those are my patient. I don't want to disclose it. On the other side, some person in Tata Hospital, he is giving to the patient his kith and kin or relatives that now there is no treatment for cancer, you go there with Dr. Mehra. Then we are giving the treatment. But I will take you with those patients who are 4th grade, and they will let you know that how much bad they were feeling when they were taking the treatment. Now, after the treatment, I am not giving the treatment. I teach them how to give the treatment. They are giving the treatment 24 hours. Previously, I was giving only in the morning or in the evening. The treatment is there. Now, each and every 2 hours, after 2 hours, they are giving the treatment. Because I had came to know now that today is 15th August. Hospitals are closed, doctors are closed, but cancer cell will not close. They are not doing any kind of holiday. They will go on increasing, either you give the medicine or not. So I am saying the same thing to my patients, that this is a cancer patient. So after each and every 2 hours, you will have to give the treatment to the patient. So the cancer cell will not increase.
But you have already get many results on treating the cancer?
Yeah.
Cured?
You see, it is by saying, if I am making the therapy, I will say it is very good. I say it's better. You ask the patient how much better you are feeling.
Yeah, but it can be completely cured cancer.
Then again the same thing has been come. Same whatever I told you. In first stage patient, why the patient should come first stage to me? They will go to Tata. Isn't it?
Yeah.
They will say that now there is no treatment. Then they are coming. Why they are coming afterwards? I have got one case from Calcutta. 3 hospitals of the Calcutta told them that cancer is there. And during that period, he phoned me that he has got this problem. I sent one person and I told him that you go on giving this treatment 24 hours in a day. I explained the same thing, that 24 hours is sufficient. Then he can be cured. Then it took 1 month over here to reach Tata Hospital and to this test. He tested all the way, each and every, so many tests he had done. I can show you that file.
Yeah.
Then finally Tata explained him that those reports are wrong, because you are not a patient of cancer and there is no cancer. Where the cancer has gone? Like Bombay Hospital or Jaslok Hospital, Calcutta Hospital, big hospital, they told that cancer is there. And Tata says now there is no cancer. Now where the cancer has gone? Because our therapist had given the treatment during that period. So cancer has gone.
How long it was the period?
It was 1 month.
1 month?
Within 1 month, that cancer has gone.
Which kind of cancer it was?
It was of lungs. I can show you the report.
In which phase? Which phase? In which phase of cancer? Phase 1, 2, 3, final phase?
Initial started, I think so.
Initial started.
I told you that 4th grade, they are feeling much better with the treatment. When the other hospital, they said that now our treatment is finished, now the lifespan is only 8 days. Now from the last 3 months, she is alive and she is feeling very good.
But do you think it is sufficient and it is easy to treat all kinds of disease by only one treatment and by only one therapy? People cannot believe it easy.
What are you treating? When I told you that cancer patient, is the cancer small item?
No.
That depression, suicidal case I showed you, he told me that he want to do the suicide immediately. And now he told you that 90% he is cured, he has got no depression, and he was smiling before you. When previously he was there, horrified that what is going on.
Yeah, but it is difficult to let people know and believe that, but by only one treatment or only one procedure of therapy, you can cure all kinds of.
You see, that's why I told you. You stay here for 2 days, 3 days, and see what type of patient we are rejecting. There is not even a single disease which we are rejecting. Should I show you? There is one case. I don't want to disclose the name of the patient, hospitals, because it is not good for me, because I need their help. You see, without we are following allopathy. Without allopathy, we cannot do anything, because I am studying those books only, and because of those books, I am finding the medicines, and whatever chemical and finding whatever their formulas, whatever their practical results are there. With that results, I am learning something, but those are very difficult ways. So I had made them very smooth, very easy. So medicine is very easy. It is not so difficult. That's why, because they made them so difficult. That's why they are taking 20 lakhs of rupees in advance for entry to go in the university. And I am taking only 6,000 rupees for 4 months to stay there, for food also. With that, I am taking only for food, but free. I am teaching them that medical is very easy. It is not difficult. Medicine is very easy. It is not difficult. They had made it difficult. But otherwise, to make the formulas in the body, it is not so difficult. It is very easy. But you must be accustomed to that. But it will take some time. Within 2 days, you cannot do like this. It will take, if you want to be very good doctor, you must do it for 4, 5 years, 3 years, 2 years. Then how many patients you will do? That much experience will be there.
From the beginning, how you teach this kind of therapy for your therapist?
To my therapist?
Yeah.
Within 45 days, they will know you see, I ask them how to eat the food, how it is going in the stomach, and what the stomach is doing, what the saliva is doing, how the saliva is making the carbohydrates, how the carbohydrates are digesting. Which enzyme is being produced in the stomach, what they are doing, and what the pancreas is doing, how the pancreas can be stimulated, which hormone. Within 45 days, they know each and everything, because I taught them the easiest way.
But with this therapy, is there some diet to follow? Is there some diet to not follow?
Because doctors are saying that you must eat non-veg, because there are so many proteins. I am against it. I say you eat less proteins, but those should be digested. If you cannot digest the proteins, where the protein will go? They will go in the waste. So best way that we should be vegetarian. God knows, I don't know. But those people who are vegetarian, their intestine is 24 feet long. But non-veg, those people have got only 20 feet.
But even veg people has a lot of problem of disease.
It is not like that the vegetarian will not die. I am not saying it. He will not die. Because the mode of treatment, the other way, why this disease has come up? 90% of the population, 80% of the population is passing undigested food in the motion. Why this indigestion has come up? Because of we are eating wheat, we are eating rice, we are eating fruits, each and everything. The grass are produced by the fertilizer, and cattle are taking those grass. So milk is also produced by the grass of fertilizer. Because of fertilizer, the gastrin in the stomach, it is suppressed. So because gastrin is suppressed, so a pH in the stomach should go up to 1. But it is not going up to 1. It is going up to 4, 5 or 4. It is not going below it. That's why undigested food is coming in the motion. That's why they are not having nutrients. This you should give to everywhere in the world. Why undigested food is coming to all the patients, whosoever it is, either it is cancer, or it is AIDS, or it is motor neuron, or it is muscular dystrophy. All these patients are passing undigested food in the motion. That is because I feel myself. Because actually gastrin is the main chemical in the stomach which is producing hydrochloric acid. So hydrochloric acid is not being produced up to pH 1. It is not going pH 1. If it is going up to pH 1, no virus or no bacteria can live in that solid acid, in that strong acid.
So with your treatment, patient should follow some diet.
Yeah, I say them that you may eat anything, any fruit. I don't say, but if he has got diabetes, then we are stopping them. Don't eat banana, don't eat sugar like rice, potatoes. He should not eat. But those who have got no problem, so we are not. But sour thing, oranges, etc. We are stopping. The person who has got cold, fever, or the other way, they have got the pain in the body. Then we are stopping it.
Is there some prevent treatment? If someone is not sick but he wants to prevent any disease, is there some prevent therapy in your neurotherapy?
Yes, so many treatments are there. If he has not got any problem, then we are setting the stomach only. But there is not only one thing. It is a very deep science I had gone through. Number one, there should not be clots in the blood. So, we are producing plasmin and heparin in the body. Plasmin can remove, plasminogen is when clot is entrapped. Plasminogen is entrapped in that. Within 24 hours, that plasminogen will be converted to plasmin. And when the plasmin will be formed in the clot will be opened automatically. Heparin has got the habit that in future, clot will not be formed in the body. So this is the way we are giving the patient heparin and plasmin treatment. On the other side, we are giving that patient 125 DCC. It is called 125 dihydroxycholecalciferol. We are producing this chemical, then it is formed in the body, then calcium will be absorbed. Otherwise, calcium will not be absorbed. We should need it.
Are you teaching your therapy around the world or only in India?
No, at present there are 200 centers, more than 200 centers in India, from Kathua. Kathua is in Kashmir, from Kathua to Kanyakumari, that is bottom line in India, from Calcutta to
They
Maharashtra.
teach and practice your therapy? Or
yes, they are doing neurotherapy only.
200 centers.
Yeah.
And around the world,
one of my students, she has gone to Canada, she had opened over there. One of the students of her, he wrote me one letter, he is opening neurotherapy center in Germany. The other, he had opened in London. So
and it's not
people
necessary,
are going over there.
It's not necessary that the therapist will be a doctor or a physician.
No. He should pass metric. Now, because I am teaching them in our language, Hindi language, not in English. I am giving you a lecture in English.
Yeah.
But to students, I am giving the lecture only pure Hindi. Pure, though that Hindi which we are speaking, very simple Hindi. It is not difficult words. Those are very, very simple words. But in those words, I am using the same pituitary gland, or what you say, liver and pancreas. I am not making the translation of these glands because I want to teach them physiology. I don't want to mix Hindi languages, that is very difficult language, then they will not understand it. So in their language I am speaking, and very slowly, very easily, very softly I am explaining them, and those students whichever they are coming to me, within 1.5 months they will know the physiology. Within next
Dr. Mehra, what is your message for each and any sick man who has pain, any disease?
We sick.
Yeah.
You see, main thing I ask them that eat nicely, chew it very nicely. Don't have any kind of worry in your brain. If you are losing some money, let it go away. Don't have tension and don't anger yourself. Don't rage yourself. Because during that period, stomach does not work. So we should not be worried. And you see me, I'm not worried about anything.
Since the stomach is the origin of all other diseases.
Everything. If stomach will be okay, then don't forget one thing. All the basic chemicals of all the hormones are produced in the intestine. Suppose thyroid, TSH. The basic chemical of TSH is tyrosine amino acid. Likewise, tyrosine amino acid is also producing dopa or dopamine or norepinephrine, or from norepinephrine it will be produced epinephrine. Basic chemical tyrosine amino acid is also for that. So other hormones, likewise these hormones, and cholesterol is, steroid is.
I think so. थोड़ा सा ना ढीला लगा नाम से ये तो एक पहले
Oda, götürürsen. Bakayım anne. Bakayım.
طلعت أقول ما شفت شيء أنا مرة صورت واحد عن
Bakayım. واحد لوحده
شو؟ لا لا غيره
كان بكفي على الأرض.
هذا راح يعملوا لي شو الأمر؟
Yeah, come back.
And massage.
What is the number? What are you doing?
200. This segment better. No?
You studied English? And where is Keshu? Holiday. That's how we meet ourselves.
बहुत टाइम हुआ मेरे बारे में तो बस सोच रामदेव जाने के लिए कैंसर कौन सा बात
Yes. Over. Okay.
Stand. This side. No.
Ya, por atas minit, pada waktu itu.
Hijo, se tiene.
Ahí está.